The diaphragm is innervated by which nerve? Correct answer is option B, phrenic nerve. The normal resting membrane potential of a neuron is approximately. Correct answer is option B, -70. Which of the following is an essential fatty acid? Correct answer is option B, linoleic acid. What is the primary function of insulin? Correct answer is option C, facilitate glucose uptake by cells. The nursing process consists of how many phases? Correct answer is option B, 5. According to Maslow's hierarchy of needs, which need is the most basic? Correct answer is option C, physiological. Which of the following is a characteristic of gram-positive bacteria? Correct answer is option A, thick peptidoglycan layer. Which of the following is an example of a primary group? Correct answer is option C, family. Which of the following is an example of a non-steroidal anti-inflammatory drug? Correct answer is option C, ibuprofen. In which of the following conditions is the pencil in glass apparent seen in radiology? Correct answer is option C, tuberculosis of bone. Down syndrome is caused by. Correct answer is option B, trisomy of chromosome 21. In a patient with chronic obstructive pulmonary disease, which of the following is most commonly seen in a physical examination? Correct answer is option A, clubbing of the fingers. The key objective of National Health Mission in India is to. Correct answer is option A, reduce the mortality rate of children below 5 years. At what age is the first dose of the measles, mumps, rubella vaccine administered in children? Correct answer is option D, 12 months. The first line treatment for schizophrenia is usually. Correct answer is option B, antipsychotic medications. The normal duration of the second stage of labor is typically. Correct answer is option B, 20 to 60 minutes. In a research study, the p-value is used to. Correct answer is option B, determine the probability that the observed result is due to chance. In a healthcare organization, which of the following is the responsibility of a nursing manager? Correct answer is option C, supervising patient care. The primary function of the cerebellum is. Correct answer is option B, coordination of voluntary movement. The body primary buffer system is. Correct answer is option B, bicarbonate buffer system. Which vitamin is necessary for the absorption of calcium and phosphorus? Correct answer is option B, vitamin D. The process of converting glucose to pyruvate is called. Correct answer is option A, glycolysis. The key principle of nursing care is correct answer is option B, compassionate care. According to Freud theory of personality, which component is responsible for decision making based on social norms? Correct answer is option C, superego. Which of the following is a characteristic of viral infections? Correct answer is option C, don't grow on nutrient agar. The term socialization refers to. Correct answer is option A, the process of learning societal norms and values. The drug class of choice for the treatment of hypertension in pregnancy is. Correct answer is option D, methyl-dopa. The hallmark of malignant tumors is. Correct answer is option C, invasiveness and metastasis. Which of the following is the correct mode of inheritance for cystic fibrosis? Correct answer is option B, autosomal recessive. The primary goal in managing a patient with a stroke is. Correct answer is option A, preventing further stroke episodes. The primary focus of primary health care is. Correct answer is option B, preventive and health promotion service. The most common cause of childhood asthma is. Correct answer is option D, allergens. Which of the following is a characteristic symptom of bipolar disorder? Correct answer is option B, episodes of manic and depressive behavior. The most common position for delivery in modern obstetrics is. Correct answer is option B, lithotomy. The purpose of randomization in clinical trials is to. Correct answer is option A. The primary role of a nurse educator is to. Correct answer is option C, provide education and training to nursing staff. The structure responsible for regulating the entry of light into the eye is. Correct answer is option C, iris. The Frank-Starling law of the heart refers to the relationship between. Correct answer is option C, preload and stroke volume. Which mineral is most important for the formation of hemoglobin? Correct answer is option B, iron. Which enzyme is primarily responsible for the breakdown of carbohydrates in the mouth? Correct answer is option B, amylase. The main purpose of health promotion in nursing is. Correct answer is option B, to prevent disease and promote overall well-being. The placebo effect refers to. Correct answer is option A, the belief that a non-effective treatment has real therapeutic effect. Which type of bacteria require oxygen for survival? Correct answer is option B. Which of the following is an example of a secondary group? Correct answer is option B, schoolmates. A patient is prescribed an antibiotic Which of the following side effects should the nurse monitor for? Correct answer is option A, gastrointestinal upset. A common characteristic of benign tumors is. Correct answer is option C, slow growth and well-defined borders. Which of the following disorders is characterized by the presence of extra fingers or toes? Correct answer is option C. The primary concern in managing a patient with acute myocardial infarction is. Correct answer is option B, oxygenation and prevention of further damage. In the event of a public health emergency, the first step is. Correct answer is option C, assessing the situations and needs. Which of the following vaccine is given at birth? Correct answer is option B, hepatitis B.